So let us start with the philosophy of modern aesthetic and restorative dentistry. Now, modern aesthetic dentistry is not cosmetic and enhancement alone. Okay, so previously, when we used to talk about aesthetic dentistry, we used to mainly consider the enhancement only. Okay, but now modern aesthetic dentistry or modern cosmetic dentistry, it is more biologically respectful. It is mainly adhesive. Now, the diagnosis will be patient-centered. So it will be a patient-centered diagnosis where we will be doing chief complaint analysis just like any other diseases. Okay, so starting with the chief complaint analysis. So what are the most common causes of a patient seeking smile correction or aesthetic correction? The most common causes are uneven incisal edges, peg laterals, there will be fluorosis stains or there will be tetracycline stains or there can be diastema, there can be short clinical crowns, or there can be previous attempted aesthetic correction. That means there can be failed composite restorations. Okay, so these are the main reasons why a patient seeks aesthetic correction of their smile. Okay, now diagnosis must classify aesthetic concern, functional deficit, and structural compromise and periodontal phenotype of the patient. Now we will be moving to the facial analysis. Okay. Starting with enamel bonding. The gold standard for long-term predictability is enamel bonding. Okay, 37% phosphoric acid, just like your composite restoration. The enamel surface is aged with 37% phosphoric acid for micromechanical retention
Modern
via.
aesthetic dentistry depends on one powerful science: adhesion. Adhesion allows dental materials to bond directly with the tooth surface. The process begins with etching, creating microscopic pores in enamel. This prepares the tooth surface for strong bonding. Next, a bonding agent penetrates these tiny pores. Light curing hardens the adhesive layer instantly. Now restorative materials like composite attach securely. This allows dentists to recreate natural tooth shape and beauty. The result is a strong, seamless, and aesthetic restoration. Adhesive science, where technology meets the art of a perfect smile.
Now, direct aesthetic restoration or composite restoration. Okay, this is another form of your aesthetic correction. It is indicated where diastema closure, short diastema closure, pig lateral buildup, incisal edge repair, mild discoloration can be corrected with your DCVs. Okay, this DCV is also known as composite stratification, and layering protocol is palatal enamel shell, then the dentin body layer. Okay, so after that you will be doing that effects. That means the mammalians and now ceramic veneer, clinically oriented approach. Okay, now in case when you are planning ceramic veneer, so we will start with case selection. The ideal case for ceramic veneer approach is intact enamel, minimal crowding, good occlusion, and spatially no parafunctional habits like bruxism. Okay. The contraindication for ceramic veneer is severe deep bite, where the occlusal force is very high in the proposed restoration sites, and edge-to-edge occlusion and large existing restoration. Okay, in case of large existing restoration, the chances of ceramic veneer failure is higher.
Ceramic veneers are a modern solution for enhancing the aesthetics of a patient's smile. They are commonly used to correct discoloration, gaps, and minor alignment issues. The process begins with a detailed smile analysis and treatment planning. Minimal tooth preparation is performed to preserve natural enamel. Next, an accurate digital scan or impression is taken. The ceramic veneers are then fabricated in the dental laboratory. Each veneer is carefully tried in to evaluate fit, shape, and shade. Using adhesive techniques, the veneers are permanently bonded to the teeth. Final polishing and occlusal adjustments ensure optimal function. The result is a natural, durable, and aesthetically pleasing smile.